Hi, I'm Erin Barber and this is Vlog 1 Skills vs Capacities in the Weightroom. The first exercise with the athletes will be looking at the squat. So we can see from the two athletes we have a beginner athlete doing a high bar back squat who has limited experience. And on the other hand we have another athlete who has experience in the squat with another high back bar squat. So we can see from the video here the athlete maintains good posture and is able to stay upright with the chest high. However, she is not able to get low enough in the squat. So we can see here she isn't able to reach 90 degrees with the thighs parallel to the floor. With this athlete, as she is a beginner, I have just used a barbell without any weight on it. As she squats down, we can see a slight knee valgus position as her knees buckle in as she lifts. Now, as a beginner athlete, this can be improved by giving more cues and bringing her onto a box to complete box squats. This way, she can be more confident in her squats. As previously, when performing squats without a barbell, she is able to reach full range of motion. Now we have our experienced athlete performing his barbell back squat with 40 kilograms. So during his squat, we can see he maintains good posture, keeping the chest high, and the barbell is in line with the midfoot. He also is able to reach 90 degrees. However, with this barbell back squat, we can see a posterior pelvic tilt and back flexion as he dips down to 90 degrees. Now, this could be anatomical or could be due to a lack of mobility in areas such as the ankles, which we will test now with a mobility movement. In comparison, the athlete here is able to maintain good lumbar posture when going down to 90 degrees. This means there could also be issues with stability in the spine when the weight is loaded. Comparing the two side views, we can see that this athlete cannot maintain full range due to inexperience of the sport, whereas the experienced athlete can maintain range. However, it comes with a posterior pelvic tilt which may cause lower back injury. To test whether the posterior pelvic tilt was due to mobility issues, I had the athlete complete some dorsiflexion ankle mobility tests. So as we can see here, the athlete is able to touch the wall with that left knee. However, he did say experience a lot of tightness in the back leg, and we can see the hip shift backwards on the right hand side. On the opposite side, there was a lot less mobility in the ankle as the athlete struggled to reach the wall with the knee. They also struggled to do so without the heel rising, showing that there is a lack of mobility in dorsiflexion. I also had the athlete complete some hamstring mobility tests. When doing so, they had to keep the opposite knee high as they did not have the range of motion in the hips to flex for this movement, meaning already we see a lack of range in the hips here. When doing these tests, we noticed that the athlete was not able to reach full range of motion in the hamstrings. Now showing a front view of the experienced athlete performing our back squat. You can see during the concentric phase of the exercise, there is a slight knee valgus as the knees buckle in when rising. This could be due to tightness in muscles such as the soleus and gastrocnemius, or possibly a weakness in the abductors and the glute medius. From a posterior view, we can also see that slight valgus when rising to the concentric phase. The athlete's knees buckle in and there is instability in the legs. In order to improve knee valgus, here we are foam rolling and lengthening the gastrocnemius muscles. After testing the abductors and gluteus medius, we found weakness here, so in order to activate them, I've included the banded crab walk, telling the athlete to push the knees out and stay in a quarter squat position. Now onto the second weight room activity. I've chosen for the athletes to perform a weighted reverse lunge. We can see with this athlete who is inexperienced with the movement, there is a lack of stability, as when she steps back, she swings the dumbbells in motion to keep her stable and upright. This is an issue of motor skills as the client is not used to the exercise and therefore is not able to stay stable when moving forwards and backwards. We can see here she stumbles as she gets used to the movement. We can improve this by creating a static movement with a split squat until the client feels comfortable stepping back. We also need to work on core strength and stability here so that the athlete is able to perform the exercise without swinging. From the posterior view, we can also see a lack of stability from the athlete, as when she steps backwards, she cannot do so without shifting the weight to one side and also wobbling, returning back to centre. From the anterior view of this inexperienced athlete, we can see a slight knee valgus as the athlete's knee buckles in as she reverses back into the lunge position. On the other hand, with the experienced athlete, we can see as they step back into the reverse lunge, there are no issues with stability. They are able to complete the exercise without swinging the dumbbells, maintaining good core strength and staying in an upright posture with the chest up, and maintaining good full range of movement. However, from an anterior view, we can see here the experienced athlete shows a slight valgus too. After doing mobility issues and corrective exercise testing, seeing that both athletes suffered from weaker abductors, we can now focus on mobility issues to restore this problem. I encourage both athletes to do the exercise again with a resistance band wrapped around the top of the knee. One of the most important cues here was to force the knee with the band out to the side, so we're activating the abductors and the glute medius here. To conclude, we can see from both videos and both exercises there were clear differences between skill and capacity issues. The athlete with skill problems needed to focus on technique by bringing the exercise back to basics and performing without weights. The beginner athlete also needed to focus on stability and repetition to gain a better range of movement and confidence in performing the exercises. On the other hand, the athlete that suffered with capacity problems needs to focus more on mobility drills, for example, focusing on strengthening the gluteus medius and abductors. They also need to focus on lengthening the calf muscles, hip flexors and hamstrings in order to maintain better range of movement in their squat and reduce the chances of a posterior pelvic tilt.